My name's Matthew Hood from Public Affairs and Marketing, and I'm delighted to welcome everybody here today to the latest in the series of health policy grand rounds that we're hosting. And it's also my pleasure to welcome Maggie Hassan, who is the current Democratic candidate for governor. It's my distinct pleasure because while Dartmouth-Hitchcock does not endorse any candidate or party, Maggie and I served together in the state Senate while she was majority leader, in addition to being the chair of several committees. By way of brief background, I'm going to let Maggie fill in the details. Maggie was first elected to the New Hampshire Senate in 2004, having served 3 terms. In 2010, she was named as one of the state's most powerful people by Business New Hampshire magazine. She's been involved in numerous legislative initiatives, including those concerning healthcare, which I'm sure that all of us are interested to hear about today. In terms of format, Maggie will speak for 20 minutes or so, and then there will be an opportunity for questions and answers. Before turning the mic over to Maggie, I want to point out that we have lots of We Care, We Vote bumper stickers, lapel pins, etc., that I encourage you to take and wear on your way out or put on your car this weekend when it dries up. So without further ado, welcome Maggie.
Did this right? Yep, that working? Okay, good. First of all, thank you, Matt. Matt Hood has served this district incredibly wonderfully in the state Senate, and one of my regrets about not being reelected in 2010 was I didn't get to work with Matt in this last session, and he's really extraordinary, and you're lucky to have him. I thought what I'd do today is just talk a little bit about who I am and why I'm running for governor, some specifics about general issues in this campaign, a little bit more specifics on healthcare, and then I assume that our question and answer session will get us into some of the details of healthcare policy. I'd also just like to hear from all of you about what you are seeing in your practice and your caregiving here, as well as what your concerns are moving forward for our state and for the people that you all serve so well in so many different roles. As Matt said, I'm Maggie Hassan. My husband Tom and I live in Exeter, where we raised our 2 children. And I got interested in politics because in my family, my parents wouldn't have it any other way. My mom was a high school history teacher. My dad survived the Battle of the Bulge in World War II and then went on to teach college and take a number of public service jobs. And so we were taught to study really hard and to stand up for what we believed in. And I think my very first political memory is actually collating League of Women Voters letters on our dining room table when you still had mimeographs and you had to staple it and fold it all up and stuff envelopes in order to have outreach. My parents' lessons really resonated with my husband Tom and me as we started our own family. We have 2 terrific children. Our oldest, Ben, is now 24. He is a funny and smart, wonderful young man. He's an Exeter High School graduate. He also has severe physical disabilities. He has cerebral palsy, and he does not walk or speak or use his fingers. And since I'm talking to a healthcare audience, he has seizure disorder and reflux and uses a feeding tube to get most of his nutrition. And he is absolutely delightful and funny and the center of our household. It didn't take Tom and me long to understand that if we were going to give Ben the kind of opportunities that all parents want for their children, we were going to need some extra help. And we were really fortunate because in New Hampshire there were community-based services and networks that helped us learn how to help Ben. So an early intervention center with really wonderful physical and occupational therapists and educators, and a school system with the kind of expertise and resources that helped us learn how to help Ben. 21 years ago this fall, a school bus pulled into our driveway and we wheeled Ben onto the lift and up he went into the bus and off he went to his first day of preschool. And all I could think about sitting on our front stoop was that had it been a generation or 2 earlier, we would have been pressured to put Ben in an institution because that's the nature and severity of his disability. I should add that my grandfather was a pediatric neurologist at Children's Hospital in Boston, so I found myself thinking a lot about the kind of observations and stories I had heard from him as I was growing up. To Tom and me, that progress, the fact that Ben could go to school in his own hometown, was extraordinary. He was going to have the opportunity to learn and the chance to make friends and live at home. That was extraordinary to us as a family. For what it means to the rest of us, it's the story of how we make progress in a democracy. Because before the Hassan family, there were other families and there were other advocates who paved the way so that our son could go to school in his hometown. That's the way we do things. We bring people in from the margins into the heart and soul and community. And when we do that, we get stronger. And that was certainly the case for our family. Tom and I were, because Ben's world expanded, we were able to both provide for our family. I'm a business lawyer. I've also spent 3 years in-house at Brigham and Women's Hospital as a labor and employment lawyer. And Tom's an educator. He's now the principal of Phillips Exeter Academy. We also eventually made the decision to have Ben's little sister, Meg, who is 19 and a sophomore in college, and by far her big brother's best friend and most able advocate. What we learned as Ben's family is that if you work together and if you stick together, you can overcome your challenges. And I'm running for governor so that every family in New Hampshire has the opportunity to succeed. I'm focused in this campaign, and I will focus as governor on what I call my innovation plan, how we begin investing in education to make sure that we have the best workforce in the country so that we can attract innovative companies to our state so our businesses can grow and create jobs. The innovation plan also calls for targeted tax credits, research and development tax credits. It calls for technical assistance for businesses, especially our small businesses. And when I talk about technical assistance, it really envisions partnering with our colleges and universities, our research capacities, our business expertise in these research areas to really help small businesses in New Hampshire leverage all of their skills so that they can be better at technology, at the kind of marketing and other financial expertise they may need, and in terms of developing international trade. When I talk about making sure we have the best workforce in the country, I'm really talking about aligning our education system at all levels with the needs of the 21st century economy. And in particular, I've focused on restoring the cuts that we have made to the university system. Remember, this last legislature cut our university system by about 50%, our community colleges by about 30%, while they also cut the cigarette tax. Their message might have been smoke more, study less to our young people. So I have focused on finding ways to restore that funding, but also in return saying to the university system, you got to freeze tuition because it is getting so expensive, it is already so expensive to go to college in New Hampshire that many of our families are finding it cheaper to go out of state to public schools there than to stay here. And all that does is drain our young people out of the state and deny us the homegrown workforce that we really so desperately need. So that's a little bit of an outline of my innovation plan. That's what I want to focus on as your governor. In order to do that, I need to win the next election. And all elections are about choices. I want to talk a little bit about the stark choices in this particular race. So I served in the Senate, as Matt told you. I served 6 years and I was Senate Majority Leader for my last 2. During that time, I was very proud to work with Governor Lynch on many of the initiatives that have really helped our state. We moved the state forward while keeping unemployment low, our tax burden among the lowest in the country, cutting our dropout rate in half, and consistently being rated one of the best places in the country to live on all sorts of metrics. And I'm very proud of that record, and I want to make sure that we build on the foundation we set with Governor Lynch and continue to move forward. The other choice is my opponent, who has consistently sided with this legislature on issues that make a critical difference to the future of our state. So Ovid, who has referred to himself as the Tea Party's favorite candidate and has said he wants to be radically different than John Lynch, has sided with this legislature in its cuts to the university system, has sided with this legislature on blocking the receipt of millions of federal dollars for our local schools, has sided with this legislature on eliminating funding for Planned Parenthood. He has suggested that he agrees with Bill O'Brien, the Speaker of the House, and this legislature's plan to opt out of Medicare as a state. I'm not talking about Medicaid right now, I'm talking about Medicare. Or he says he wants to block grant it, which means either way that he would leave health care of our seniors at the mercy of a legislature that, as you guys know better than anyone, has just made devastating cuts to health care in this state. That is not something I will support. And he does not support a woman's right to make her own health care decisions, and he would repeal marriage equality, both of which are things that are not only harmful to our citizens in terms of their own civil liberties and civil rights, but are harmful to our economy. Much of what we have spent discussing in this race is, as I talk about full inclusion of all people and talent and energy in our state, so that we can have as strong a workforce and strong an economy and strong civic life as we possibly can. Ovid has consistently told me that those issues are, and I'm quoting, not topical, because he says a woman's health care issues are really social issues, and really he hasn't heard any voters being interested in them at all this season. That's the stark difference here. I know I heard a little bit of a laugh, and I have to say, you know, when you think about it, when I think about women having access to affordable birth control, cancer screening, and fertility treatments, and somebody telling me that those aren't economic issues, I find it a little bit hard to take. That's some of the distinction in this race. We have got a lot of work to do in this state. I know that this community in particular is really struggling with the budget cuts that came down the pike with this last legislature, and it's something that I want to work with all of you to find ways to restore. Another major difference between Ovid and me is that I would accept the money from the Affordable Care Act that is designated for the expansion of Medicaid. I think we have to make sure we're doing it in a way that makes sense for New Hampshire, but I'm sure we can work with the federal government to do that. But I want to expand health care coverage for the people in our state. I want people who are working but can in no way possible afford the cost of private health insurance to have access to preventive and primary care for all the reasons that you all know better than I do. That's what's at stake in this election. This election is really close. Polls have me up 2 points or down 1 point or Ovid up 1. It's going to be like this from now to Election Day, which is about 17 days from now. I'm here to talk to you more about what I would do as governor and hear more from you, but I'm also here to ask for your help in the next 17 days if you are all inclined. I know how busy all of you are, but I know what's at stake in this election. We are either going to move forward, as I said, in the direction set by Governor Lynch, with an attitude and goal and a belief that people in government can actually come together and solve problems and move forward on behalf of the people of this state, or we are going to allow ourselves to be dragged backward to a place where there's no public kindergarten in the state. That's something else Ovid doesn't believe in. Where the state doesn't have any obligation to fund public schools at all, to a place where Ovid has suggested the legislature should run health care for everybody and fully deregulate health insurance companies so that everybody's just on their own. That's not the vision that I have. And my own experience tells me, my experience as a lawyer and as a mother and as a state senator, where I've spent most of my life bringing people together to find common sense solutions to complicated problems, tells me that what we always do when we succeed is we have a strong partnership between a constructive problem-solving government and businesses and nonprofits, that we cooperate and we collaborate and we move forward. And that's very different from the vision from the Tea Party right and my opponent right now, which says just everybody should go it on their own. It's never worked. It leads to division and conflict and chaos. And it doesn't move us forward, and it certainly doesn't allow us to compete in a global economy. So that's why I'm asking so much for your help. And there's one last reason that is a little bit perhaps Concord-centric, or perhaps former state senator-centric. But I will tell you this. I served 6 years in the state Senate, And during that time, I was so moved by the fact that in New Hampshire there are 424 legislators getting paid $100 a year, and that's set in our Constitution, by the way, so it's not going to change anytime soon, who actually go to Concord and come together, even with partisan differences, and until this last 2 years, actually in good faith came together to try to solve problems. And even better than that, people from around the state, ordinary people, farmers and mothers and doctors and nurses and teachers and business people and unemployed people and teenagers sometimes, would come to the State House and tell us what they care about, what their lives were like. And they didn't just tell us because they thought they should. They came to talk to us because they had the expectation that we would actually listen and incorporate their experience and their advice and their hopes and their dreams into our decision making. And we actually did that. And that doesn't happen in a lot of the rest of the country. It certainly isn't happening in Washington. So when I talk about what's at stake in this election, part of what's at stake at this election is what our founders believed in. Democracy has actually worked in this country and this state for 200 plus years. Not easily, not always well, we fight a lot, that happens, but at the end of the day we have come together and we have moved forward and we have been better for it. And that hasn't happened in the last 2 years. There is a fundamental challenge to that very concept going on right now. So I hope you will all join with me, not only because there are so many issues that I can lead on and we can make progress on together that are important to the daily lives of the people you all serve and I hope to serve, but also because I want to make sure that people around the country know that our founders were right, that New Hampshire continues to do democracy just about better than anywhere else, if not the best, and that democracy actually works. If we do that, we will not only succeed economically, but we will begin to restore some level of confidence in government and problem solving and citizen activism again. So with that, I will close my remarks. Thank you for listening, and I'd be happy to take questions. Okay?
So I have the mic. I'm happy to walk around for people who have questions, and I see one right here. Roddy?
There was a report that came out today on the hour migration of manufacturing jobs,
Right.
talent, and everybody here. Our jobs depend on people in the state being here to serve them, and if the trend were to continue, not good for anybody. You talked about the innovation. I'd love to hear more about how do we stem that tide and maybe turn it the other direction.
Yeah, thank you for the question. So the question was the Center for Public Policy in Concord has done an initial report that I think they're going to follow up on about demographic and economic and business trends in the state and how they affect our economy and our future planning. What I am hearing from businesses around the state, and manufacturing is still our strongest sector. Manufacturing is our #1 sector, and then tourism and travel is our #2. I am hearing that they've got jobs that they want to have filled, but they don't have skilled workers to do it. We have some pilots going on in the state that are really informal partnerships where an employer has approached a community college, let's say in Nashua, and said, look, we'll buy the equipment we need to train people for. Do you think you can help us find faculty and you can actually help us find students and train people up? We need to make that into a more robust and organized system throughout the state. The good news is that we have new businesses coming in, like Albany International in Rochester, which is an aerodynamics company, and I honestly really don't understand what they do. But they do, they make very fine coverings, lightweight, strong, flexible coverings for aerospace. And they will tell you that they chose New Hampshire because of quality of life issues, but also because when they called the state economic development department, they got a call back from the commissioner within hours to say, how can we help? They got a call from the governor within a few more hours saying, we really want you here. Then they got the chancellor of the community college system who called them, and they set up a whole program for training those 400 workers. and that brought them to New Hampshire. We were competing with states that were offering them hundreds of millions of dollars of tax incentives, for instance. So that's the kind of way we need to go at this. And we also need to, in our K through 12 system in particular, improve and make much more rigorous our science and engineering and math standards. We've been given about a C- or a D grade on those standards. And it's not just about strengthening the standards, it's also about working with educators for more hands-on curriculum. Because one of the things we're also learning is that a lot of our young people don't feel that they have the kind of basic capacity in those areas to pursue careers in them that will allow them to be the workforce in advanced manufacturing. One of the things I've also learned by being on the floor of a lot of manufacturing facilities is that a manufacturing assembly line isn't what it used to be. It's a very different experience. It's not just that it's cleaner and more high-tech. People are running these huge machines at the paper mill up north or down in the wood pellet company in Dublin or Peterborough, or Jaffrey, I guess it is. They're using computers to run all the machinery, but they also have to have the kind of communication and collaboration skills to take new specifications that they get at 5 o'clock on a Friday afternoon and have the assembly line up and running by Monday morning for a whole new set of specifications. And so we really have to have an education system looking at that. So it's a mixture of on-the-job training now, retraining now at our community college system, but also some long-term looks at our K through 12 system.
Name.
Sure. My name is Jonathan Ballard. I'm a preventive medicine resident here at DHMC. In health policy, we know that one of the biggest issues is the skyrocketing cost of healthcare itself. At the Dartmouth Atlas, we know that there's large variation in cost across the country, and the areas that spend much less on healthcare still have the same outcomes as those that spend much more. That being said, I'm interested in what are your thoughts on the role of government in limiting those costs. Nationally, there's been proposals to send Medicare, which reimburses us for anything we pretty much ask them for,
Right.
to the states, where under Governor Lynch we've seen some innovative, interesting ways to decrease the cost in the Medicaid program.
Yep.
If it was sent to you as a state program, could we run it effectively?
So I'm going to answer this in two parts. I generally believe that what's been called block granting of Medicaid or Medicare, which is something my opponent has suggested he might do, has never been a good deal for the states. Because what happens is the feds give you a set amount of money and they say, hey, you're on your own, and you never get the adjustments for inflation or costs that you would. And especially for a state like New Hampshire, where our poverty rate is very, very low, other states tend to get a lot more funding than we do. So that's my initial caution. I want a good deal for my state. I have been a big supporter of the initiatives around medical homes, accountable care organizations, electronic prescribing that have come under Governor Lynch's leadership, and I was a participant in something called the Citizens Health Initiative as well. One of the tussles I had with the healthcare community when I was in the state Senate was I began looking, I'll back up and tell you the story that generated some of my thoughts. In Exeter, I have a friend who runs her own tailor shop, solo employee. About 8 or 9 years ago, she had significant cervical pain, which everybody thought was because she spends her day over a sewing machine. Turns out it was nerve pain from a tumor in her wrist, and she had a rare form of cancer, and I don't know more than that. Except that they managed not to amputate her hand, gave her radiation treatment, and she has been cancer-free for some time. She is a sole employee, has always carried health insurance for herself. As it got more and more expensive in New Hampshire, she took on higher and higher deductibles. She is told she is supposed to have a full body scan every year because of the kind of small cell cancer she had. She can't afford it anymore in her deductible because the cost went from like $1,500 for the scan to something like $7,000 or $8,000 in 2 years. My guess is she earns between $30,000 and $35,000 a year. So one of the things that I worked on in 2010 was trying to figure out if we could have a uniform and systematic way in New Hampshire of understanding healthcare costs at all of our various healthcare institutions, because the variation in cost was as much as 70% for a single procedure, even when you control for patient mix and reimbursement provider. And I still think that we need to understand the various cost drivers in different institutions around the state to understand why we are a particularly expensive state, which we are, for the basic market basket of services. I would like our response to that, our solution to that, to be driven by all of you. And Dartmouth has done, and the Atlas program has done such great work that I think we are making progress towards it, and I think the Affordable Care Act will help push us more in that direction. But we have to do two things. First and foremost, assure that whatever system we're using improves the outcomes for the people we're serving. And as the mother of a child who's had as many as 9 doctors and 19 medications, now probably 25 at a time, I think that there's a lot of room for improvement and coordination of care. But I also think that we, at the same time, need to be looking at what's driving our costs and making sure that we are doing everything we can to try to at least stabilize the cost curve and eventually bend it the other way. But I look forward to the leadership of places like Dartmouth to help us do that.
Is there a
Thank you for being here. I'm Deanna Howard. I work here, obviously. We've talked about taking money from Washington. We've talked about cutting costs, but there certainly is a revenue issue. I know you've taken the pledge. And Matthew, I can't remember our graph that we love so much, but you've probably seen it from public policy. It shows sort of over the decades how New Hampshire has managed to fill the gap.
Yeah.
You know, we always spend more than we take in, and we always have to find some trick to sort of make the budget work.
Yeah.
I think our last trick was sort of dish and met, and that whole debate continues. But we're kind of, I think, used up. The rabbit hat is empty. Unless you can share with us what you think might be the next revenue kick, if we can have taxes that will help to cover some of these costs that you've talked about restoring, whether it's education or healthcare. Thank you.
Yeah, thank you for the question. A couple of preliminaries. One is I'm the only candidate for governor in this race who's actually balanced a state budget and done it with about a $20 million surplus, which was the 2009 state budget, which was extraordinarily difficult because it was the worst economy since the Great Depression, and our revenues dipped about 25% overnight. We made some really tough choices in that budget, but we still protected our citizens and our economy. We kept our school funding level while other states were cutting it. And I'm proud of that record and would consider that approach again, which is bringing people together and finding strategies for funding what we need, for making some tough decisions. We cut some programs, we closed some outdated facilities, that kind of thing, to balance that budget. And I think the people of New Hampshire need to know that we're always willing to look for improvements and efficiencies. Towards that end, I've introduced a budget reform plan that includes a different way of coming to our revenue estimates so that we all have some agreed upon facts, so that we don't have this partisan back and forth about how much money we actually have. We should start with an understanding of that. Secondly, to improve our audit process. Right now we don't audit our biggest state agencies very often, and that's where the most savings would be. Plus we don't really implement our audits once we do them. And third is to have performance measures in state government so that we can really have a transparent way of understanding how taxpayer money is being used. That being said, I have talked about restoring some of the cuts that were made, and I have indicated in this campaign what my approach would be to doing that. We will see some modest revenue growth over the next year or two because the economy is improving, and that always happens. I would reverse some of the bad decisions that this legislature has made, the cut to the cigarette tax being one, The laying off of auditors in our revenue department being another. Sounds like a small thing, but auditors actually pay for themselves and bring in a fair amount of revenue to the state because they make sure people are paying their fair share. And the Tea Party kicked a whole lot of the auditors out. So we've lost revenue that way. I also would support one high-end, highly regulated casino near the Massachusetts border, a conclusion I've come to because Massachusetts is building casinos. We have a ton of gambling in this state, and the analysis shows that we will lose not only gambling revenue, but rooms and meals revenue to Massachusetts, while the social problems associated with gambling will come back to New Hampshire. And I just as soon have the revenue here, attract some folks from Massachusetts here, because the analysis also shows people would prefer to drive to New Hampshire than go farther south or towards Boston, and control it well and address the social and safety concerns that certainly are real with gambling, and they are, just as they are with alcohol, which we sell on our highways. And yeah, we do. And take advantage of that money for our schools and roads and bridges, and some for North Country economic development. I don't think we should have more than one. And one of the differences between Ovid and me is that he said he would support a casino just at Rockingham, which also happens to be a client of his law firm's. And I don't think we should predetermine the location. I think we should have open and competitive bidding so we get the best deal we can, and so that people have confidence that it's a fair and open and transparent system. So those are some of my thoughts on how I would address the revenue issue. I want to be frank, we do not restore everything all at once. When you have the kind of economic hit that this country and this state took, where revenues went back to pre-2004 levels pretty much overnight, you can't magically change that. And the people in this state believe, and I agree with them, that we have an economy that works well without a sales or income tax, and all our metrics tell us that we're doing better than most other places without one. So it's hard to argue that you'd want to fool with that. But what you do need to do is be committed to bringing people together to understand what goals we want to achieve, and then finding strategies for solving them. And that's also true. We have some particular areas where that's an issue around transportation infrastructure too. Yeah. Hi. Good thinking.
Thank you.
Hi, I'm Carol Olwer. First of all, I want to say, as a citizen, thank you for running. I know it's not an easy thing to do. It's not necessarily a fun thing to do, but it takes an awful lot of courage, so thank you for doing that. What I want to ask you about, you made a statement about our tax environment being so positive in the state, and that's true unless you're a property taxpayer, where New Hampshire is in the top 5 per capita in property taxes paid. So how do you see your plan to grow business, grow revenue, help education affecting the cities and towns, and at least stabilizing, if not reducing, the tax burden there?
No, it's a good question, and certainly people struggle with their property taxes here. One of the things that I find when I ran 5 state Senate campaigns, so I probably knocked on almost 10,000 doors in those 5 campaigns, which is the absolute best part of campaigning in New Hampshire. And something I miss in this campaign a lot, because New Hampshire citizens actually expect you to be there, and they're pretty receptive when you show up, which always amazes me. And every now and then they actually tell you what they think, and property taxes is on the top of their list. Interestingly, they also vehemently don't want an income or sales tax because they think it's just an addition on top of their property tax, and they really don't believe that their property taxes will go down. What I have been committed to is making sure that we continue our state aid to education at least the level it is now. It's eventually over time, with the formula that we put in place, it increases over time because the cost is going to increase. My opponent would pass a constitutional amendment that strips away all of the state's obligation to fund local education, which would do one of 2 things. Dramatically overcrowd our classes or dramatically increase property taxes. So I know people don't want me just to reduce this discussion to the choice in this election, but elections are about choices, and right now the other choice is somebody who doesn't believe that the state should provide much aid for education, and that will drive property taxes up. in terms of relief for property tax owners, I think we should look, the statewide property tax has an exemption clause for people at a certain income level. And I think it deserves looking at whether that should be adjusted to provide more relief to people, at least for the statewide property tax, based on their income and what percentage of their property tax, what percentage of their income their property tax is. Let me put it that way. And I also think we need to work with our local governments to see whether our model of local service delivery still makes sense in this day and age. That's something, though, that needs to come up from the grassroots. New England spends about 25% more for local services than the rest of the country. And it's because we do it town by town. Something we love and we're very proud of, but it has a cost. And so that's something, I started to do work on that in the state Senate around wastewater treatment in the Great Bay region, because every town was being tasked with coming up with its own wastewater treatment plan, which is extraordinarily expensive. So those are some thoughts on it. It's not, overall our tax burden is still one of the best in the country. It is very difficult for property tax payers in certain financial situations, and that's one of the conundrums we have to work through.
Thanks for your candidacy. I'm Ken Elkhart. I'm a geriatrician. I'm actually here to learn about your ideas about Medicare and to discuss medical issues. But on the comment of taxes, has it ever come up in the state of New Hampshire to have a voluntary, and with Claremont issues, with unmet state needs, and the pledge, which is wise to take in the state, has it ever come up that one can voluntarily take one's property taxes, put it towards the State House, which has an agreement with the towns to say we will do some funding statewide to provide reimbursement towards meeting the Claremont decision, so that there's a net negative, you don't have any overall gain as a voluntary process? Is that legal? Is that...
What a good, I don't know whether it's legal, and I've never heard anybody suggest it. So thank you for the suggestion, and it's given me something to think about.
You can certainly compete with United Way and voluntary donation. That'll be good. Competition. I wanted to ask you a question, which is, I guess, in part strategic. I take care of a lot of folks who are of Medicare age currently, and certainly a lot of folks who are in New Hampshire are worried about eking out enough of their income to or their job to maintain their insurance until they fall onto Medicare. Right. This issue with block grants, I mean, I think there's no question there has to be a lot of innovation in how we reimburse for proper care for our elderly. But the efficiency of Medicare is strikingly more efficient than private insurers. And I don't watch TV too much these days. I'm not sure what you've got for ads, but it strikes me that most people who vote who are over 65 are thinking about Medicare would say, I don't want to take a chance with my Medicare. It is the most popular insurance in the United States. So is this a point that's being played up? It's not in the press that I've seen much of.
Yeah, I have been talking a lot about Medicare in this race because I think it is so important to so many families and to so many individuals, and I think it's a model that a lot of people will continue to look at as the Affordable Care Act is implemented, which I hope the Affordable Care Act will continue to be implemented because I like a lot of what it's already done for our citizens. But in terms of the framing of this race or what you're seeing on TV, mostly there's a lot of negative ads against me from the Republican Governors Association right now. We've been putting forward some ads that really talk about the distinctions in this race, and Medicare is one of them. And it is true that when we talk with people about how would you feel if we just got the Medicare money and then the legislature just decided what kind of benefit package our seniors would get, people do not like that idea, and it's not just seniors who don't like that idea. I think the average person understands the importance of the Medicare guarantee. One of the great frustrations I have, Ovid also has signed a pledge to a group that says health insurance should be completely deregulated. And one of the things I try to remind people in forums like this where you can do a little bit more back and forth is that Medicare came about because no private health insurance company wanted to insure people who were 65 or over. They're just not a good deal if you're a for-profit insurance company, and I don't have anything against making profits, but healthcare and insurance are not the best match anymore. And we're all here because of the development of an accidental health system, really. And now we're trying to come up with a countrywide and statewide system that works for people, and we're going to be transitioning to different things over time. Medicare, though, I think is something that people really want to keep secure, so we've been talking a lot about it.
You talked about retail politics in New Hampshire and that you have expectations of the candidates coming to your door. I actually think that New Hampshire voters don't make up their mind until the fourth visit from the candidate. And so, but I know that this is not the fourth visit for Maggie to your homes. So let's take advantage of the next 10 minutes we have for more questions.
Hi, my name is Steve Woods. I work in human resources. I'm very much against gambling.
Yep.
At Dartmouth-Hitchcock, we believe very much in doing the right thing, do the right thing for the patient, and the organization will stand behind you. I don't see how gambling really passes that test for the state of New Hampshire to endorse it through the state. And the other thing that puzzles me is it seems that our legislators have a great deal of confidence in their ability to control gambling, to make sure that the costs of gambling are somehow contained, that if we were to allow gambling, we could allow it in just one place.
Right.
And yet, when it comes time to talk about possibly placing an income tax on the table, then our legislators don't seem to have the confidence in themselves to manage an income tax and to keep themselves from raising it. And I'm just not quite sure how to square those.
Yeah, thank you for the question. So I'll just go through my thought process a little bit. First of all, I don't think prohibition in gambling works any better than prohibition in alcohol. So I have a hard time understanding why people think gambling is such a bad idea when we are so comfortable with alcohol. And the way I compare it is, for many people, alcohol is something they do in moderation and they enjoy. It's good with a meal. A glass of red wine at night is a nice way to relax. We socialize around it, and we all accept the fact that part of the price of having legal alcohol is that alcoholics will have access to something that for them can be absolutely deadly and devastating to their families. But we're comfortable with it. I have tons of friends who gamble recreationally. I don't get it. I'd rather go be in the White Mountains hiking, or walking my dog in the woods, or at the gym, or listening to music. But I have friends and relatives who go to casinos on the weekends and have a great time. And they like to spend their money that way. And a small percentage of the population, I think the research says 2 to 3%, can get addicted, especially to slot machines. I don't see how that's different than alcoholism, which we accept as a cost of a recreation that most of us enjoy. So from my perspective, the libertarian in me says there are people who like to gamble. In New Hampshire, I just was at social function in Manchester last night. There are a ton of people who would say to me, I'd much rather voluntarily give the state some revenue through gambling than have the state tax me anymore. And that's the way our culture in this state has always worked. So my view, the other thing I know from 6 years in the state Senate, is that we have a ton of gambling here. And for those of us who don't gamble, we never see it. It's illegal. Some of it's legal in the lottery. Some of it's been legal at Seabrook and at Rockingham, and for a while up in Belmont. We have a huge amount of charity gaming going on right now, and we have some illegal internet gaming going on. So I get back to the fact that 2 or 4 years ago, sitting in the state Senate, a representative of Gamblers Anonymous from the national group came to talk about a bill about expanded gambling and said to us, we're not here to take a position. We think it's equally as good or bad for you to expand gambling. What we're here to tell you is that if you expand gambling, please use some of the revenue to treat people in New Hampshire for addiction, because right now the only people in New Hampshire getting treatment are those wealthy enough to go out of state to get the treatment. Poor people who gamble have no options here. So all of that adds up to my feeling that I would rather compete with Massachusetts, have a high-end, highly regulated casino, which we can establish. We can establish one license, and we can write a bill that says the state has a compelling interest, and this is the lawyer in me speaking, to have just one. There's only really a market for one high-end casino. We're 1.3 million people. And have it here, grab the revenue, treat people with addiction, improve our schools, use some of the revenue for North Country economic development as well, and confront the fact that gambling is here. New Hampshire residents are the second largest group of people who go to Foxwoods in Connecticut, and 40% of the license plates in the new casino over in Maine are from New Hampshire residents. And I just as soon have the revenue here and deal with the public safety and public health problems that come with it here. So that's my thinking about it. I don't know that that'll change your thinking about it, but that's how I came to it.
So maybe one more question.
Hi, I'm Jean Brown.
Hi, Jean.
I wonder if you could share some of your thoughts about the process of New Hampshire creating its exchange, which we have a deadline of, what, 2014 or 15? There's so much resistance to it. Yeah, how do you see that working out?
So we had the opportunity under the Affordable Care Act to accept federal money so we could develop our own exchange, which is what I thought we should have done. Once again, the Tea Party said it's federal money, it must be bad. And so the Executive Council rejected the acceptance of the money. And what that means now is that unless we find a way to accept some last-minute federal money under the Affordable Care Act to do it, the federal government will set up our own exchange, which I would prefer not to have happen. I'd rather have New Hampshire Insurance Department setting it up. Some of this is going to depend on the outcome of the election, both federally and here, to see whether there will still be an opportunity for us to get our own money and set it up, and then whether we have time to do it. It's a hard thing to do in a short amount of time, but it's something I would like to try to do, because I do think I'd rather have our insurance department here, which knows this market so well, and our healthcare providers here really have the kind of input that I'm not sure you'd have with the federal system. Yeah, especially we have a lot of consumer protections in our current benefits packages under private health insurance laws that the feds don't necessarily have, and that's one of the things that I'm trying to understand better, because I'd like autism coverage, which is something I work really hard to get in our state law to continue, for instance. Hey, Frank.
Hi, Maggie. Thank you for coming. I just have one quick question off the microphone, and that's I was reading the other day that the race for New Hampshire governor, there might be $12 or $13 million spent by the two candidates, and big contributions from the RGA and the DGA.
Yeah.
Now that you're in it, up to your ears, and do you think there's a better way to do this than 20 minutes of commercials and 10 minutes of news on MUR at 6 o'clock?
Yeah, well, I certainly think we could feed a lot of children with the money that we spend on campaigns, and that really bothers me. I will also tell you, you mentioned earlier it's not easy to run for statewide office. I have to tell you, other than getting married and having my kids, this is the best thing I've ever done. And it's because it's New Hampshire and people still talk to us, and I actually get to do retail politics. And even when I'm phoning people for money, they give me an earful in response. So it's really been a great opportunity, and it has not been totally spoiled by the influx of money. For those of you who are sick to death of television advertising for all levels of campaigns, which I actually was home, I don't know, a couple Saturdays ago, home in time to see the 6 o'clock news, and I was appalled by how much advertising there was, much of which was mine. So I was like, oh my gosh. And so, though mine was positive, so at least there was that, right? But but until we get to a point where we have a constitutional amendment to overturn Citizens United, which probably this audience knows, Citizens United Supreme Court decision that said corporations and others can spend as much as they want on political advocacy, as long as it's not particularly in favor of a candidate, but it's an issue or against a candidate. Until there's some sort of amendment to that, what happens is this: New Hampshire law says I can accept only a certain amount of money per contributor, and I have to fully disclose who my contributors are, which is fine. Same with Ovid. But super PACs can spend unlimited amount of money on essentially negative advocacy. So that means that all this huge amount of money goes to negative advocacy, which is on TV, some straight issue advocacy, but mostly negative, which turns everybody off. So now everybody starts thinking, God, this politics thing is the worst thing ever. And it actually doesn't reflect, as I said in my remarks, what actually happens in Concord, and Frank, what I know you know happens in other state houses. And where actually there's some pretty constructive things that go on most of the time and in most of our history. So, but the Citizens United case has created a system where vast amount of monies go into a pot that can only be spent secretly and negatively, and the people who are actually named candidates can get very limited money to try to do positive things. So you see this great distortion of tone that doesn't reflect what I think happens in the best political systems. So one of the things that I think would unify Americans everywhere is if we said, would you support a constitutional amendment to get political advertising off TV? I think people would jump at it. And I think we should really, there is a movement to try to overturn Citizens United. In the meantime, one of the things I worked on in the state Senate was making it a requirement that super PACs actually have to disclose their donors in New Hampshire if they wanted to play in New Hampshire. And that's something, we passed it in the Senate, it got shot down in the House. But one of the things that the Citizens United case did say, it's one of the few times I've ever agreed with Justice Scalia, is it said democracy is not for cowards and disclosure can be required. And I do think that we should be pushing for that at the state level as hard as we can, just to try to level the playing field a bit. Sorry for the long answer, but it's something I'm passionate about. Yep.
Maggie, I was somewhat premature. There are other hands that have gone
Yeah,
up.
no, that's
If I
good.
say,
That's
do you have
good.
time to take
Yeah,
another?
yeah.
Okay. Sorry. Thank you.
Peter, you had me worried. I was concerned you were going to break the streak.
Is there a little bit of bingo going on that I don't know about? Yeah, wait.
Here's our top question.
Okay, well, first,
My name's Will Torrey. I'm
Hi, Will.
a psychiatrist.
Yeah.
Worked in community mental health and here for many years. I was moved by your story about your son, but also know that there are many, many families who have children and loved ones who have developed severe mental illnesses. The access to behavioral health care has been eroding.
Yeah.
Community mental health centers care has been bleeding out for many, many years. And just wondering about your approach to that.
it is one of my top 3 priorities. I got asked earlier today what keeps me up at night. First and foremost, I need to win this election. That keeps me up at night because of the alternative with this Tea Party ethos. But not in perfect order of priority, but mental health and our chin system keep me up a lot. And it's one of my priorities. Again, I start with, we're not going to restore this all magically all at once, given what the economy is doing and who we are as a state. But I do understand the value of community-based services. I hear from constituents all the time about loved ones with mental health challenges. And one of the things that I think is going to be helpful in terms of finding the political will and resources to do this is that law enforcement is totally concerned about this. I mean, they're getting it. When I got endorsed by the Manchester Police and the Concord Police, and one of the things they've asked me to work on is community mental health services, because they're seeing it in every aspect of their work. When you get that kind of coalition in a political system, you begin to be able to find ways and resources to move forward with it. And it's something, I can't give you specifics yet, but you know, every family has somebody, every community affected by mental illness, and my family is certainly no different.
Thank you.
Thank you very much for coming here. This has been a very interesting and enlightening conversation. It's actually taken me a long time to come up with a question, something that will surprise a lot of people here. But the main reason I've had a problem with coming up with a question is that normally in a case like this, I'd have a question about how we would raise money, how we would distribute money, what the appropriate role of the government is, and so forth. But as you've made it clear, the fact that your rival is running on a platform that basically says the government shouldn't be doing anything means that there's a large percentage of the population that believes that there isn't a role for government in making any of those choices. And in part, I think that's due to the fact that we're in the 5th year of one of the worst economic downturns this country's ever seen, but in part it's due to the fact that we've become increasingly splintered as a society. I have no idea how many channels there are on my cable TV. I've never managed to count it. It's in the hundreds. There are literally millions and hundreds of millions of websites out there. We see and do different things all the time. We no longer have a society in which we have all seen the same programs, talked about the same subjects, have a common understanding of what it means to be in a society. So my basic question is, how do you govern in a society like that?
Thank you. It's a great question. And I'll start, I guess, with a couple of thoughts. I don't think that there's a significant majority of Granite Staters who really don't believe there's a role for government. When I go out and talk to people about education or about healthcare or about public safety or about environmental protection, most people, when I put it in fairly basic terms, do understand that we need a level playing field and some basic rules. They want the rules to be smart. They want the rules to be effective and make sense to them. I do think that as somebody who has spent her public service time in state government, people have a hard time relating what state government does to how it actually affects their individual lives. Because we've had a system that has worked pretty well for so long, people don't really understand how it got created. You know, I mean, it's a little bit like the newest generation of young women who've always assumed that they'd have access to birth control and abortion rights. And it takes a lot of work to get them to understand that those were hard-fought victories for women and that they can slip away. And so part of the problem we've got is that people are so focused on jobs in the economy, rightfully so, because so many people are struggling, that they're looking at that very immediate need that they may have, and they really aren't paying attention to the erosion of other things that's happening. And I have to say that the Tea Party, again, and I'm using a pejorative term here, I just don't know what else to call it, so it's a convenient term. But this new brand of far-right extremism, very different than the New England Republicanism that I grew up with. My family was half and half. They've done a very good job of being brazen with their actual legislative agenda over the last 2 years, but they have campaigned running away from that agenda every chance they've got. And it's really confusing for people. So my opponent spent the primary going around to conservative groups saying he wanted to be Scott Walker, the Wisconsin governor who tried to break the unions and has successfully done it in a couple of cases, wanted to be Scott Walker on steroids. He told people that he thought Bill O'Brien, this Tea Party speaker, was great and courageous. He has been endorsed by all these incredibly conservative anti-choice groups, anti-birth control, human life amendment groups. Yet, and has said, the state should not ensure kindergarten for every child, because if the state can do that, oh my goodness, what could happen next? That's a quote. I say first grade, but so he has said all these things, but when he campaigns, he has been running away from them. When I've challenged him on Medicare, he said, Maggie, why are you talking to me about that? That's a federal issue. It's on his website for his gubernatorial campaign. but they have been running away from this consistently. So that's part of the dilemma, that marketing is one thing and the actual agenda is another. And part of the challenge for me is to make sure people understand what the real agenda is, and that's something I'd ask for everybody's help with. Your bigger point, though, is a really important one. When my dad came home from World War II, having survived the Battle of the Bulge, he and his fellow veterans were used to a level of common goal and sacrifice that drove them to build a great post-war America in all sorts of ways. And there was a common understanding of facts, there was a common ethos, and there was a common understanding of what it meant to be patriotic. And I do think that that has splintered. One of my hopes as governor is to find a way to lead a discussion about what it is that we do together as citizens in what we call government. And you know, every political pundit out there will tell me, no, don't, whatever you do, do not defend government, people will hate you. But it is about citizens coming together and making their own decisions and deciding what kind of state we want to be. And I need to find a way, and I've been talking about folks, for instance, who are graduates from Leadership New Hampshire series, to find citizen leaders who could help us facilitating ongoing common discussion, maybe with social media component, maybe with some live town hall components, about, first question everybody, what is it we want local and state government to do together? Secondly, what do we think it costs? And how are we going to measure what it costs? And how are we going to measure what it does? And do we do it well? Is there a role for public-private partnership? Because in New Hampshire, given our anti-tax culture and given our pride in our unique tax status, is there a role for private-public partnership that would be unique to New Hampshire that would still allow for democratic participation in decision-making? And then the last part of that is, once we decide all those things, how are we going to pay for it? We are a grassroots upstate. Governor doesn't get to make decisions and tell people what to do or tell people that they're wrong, because the citizens actually know what the heck they're talking about. It's one of the things you learn going door to door. But we are going to have that discussion. I think New Hampshire is a state that can have it. What I haven't figured out yet is how a governor drives that discussion in the middle of a busy legislative session and a budget. But I'm quite convinced with citizen helpers we could do it. And that's one of the things I'm putting on my agenda.
All right. Thank you very much, Senator Hassan.
You're welcome.
Thank you.